Vaginal yeast infection is very common in pregnancy. Hi, I'm Dr. Kamna, Nagpal, Associate Director, Max Hospital, Mohali. Today I'll be talking about yeast infection in a pregnant woman. Now, yeast infection is a fungus. The most common is Candida albicans. In a non-pregnant woman, it's about 20% likely to occur. However, in a pregnant woman, it is 30% more likely to occur. Why so? Because of hormonal variations and fluctuations in pregnancy, the vaginal pH environment is more favorable for the yeast infection to grow. Now that we know what is yeast infection, let us discuss the signs and symptoms. The most common will be redness of the private parts. You will also get vaginal discharge, which is thick and curdy. There will be redness also and itching also of the private parts. There can be foul smell also. There can be burning on micturition, that is while passing urine. So these are the signs and symptoms of yeast infection. Now, how do we diagnose yeast infection? When a patient comes to us, we take a history regarding the discharge, since when it is present, and whether it is recurrent, has she had any treatment earlier for that. Then we do a local examination of the private parts and see if there's any erythema, any discharge. After this, we put in a gentle per-speculum examination. A speculum is a small instrument which we insert into the vagina to see the cervix and the vagina. And then we see if what kind of discharge is there, any redness is there, any smell is there. Sometimes we take a vaginal swab from there and that can be sent for culture. Normally, it is a clinical examination that we confirm the diagnosis. Only if it is a recurrent infection, we send it for culture. As I said earlier, yeast infection is 20% likely to be present in a normal woman, but in a pregnant woman is 30% likely to be present. Now, what are the complications in a pregnant woman due to yeast infections? The mother does not seem to be affected by yeast infections, but during normal delivery, the yeast infection can be transmitted to the baby. So newborn baby can get yeast infection of the oral area and diaper area. However, if a baby is compromised or premature, it can affect systemically. It can be transmitted to the lungs and other parts of the body of the baby. The second most common complication of yeast infection in a pregnant woman is the preterm rupture of membranes due to infection. So due to this, the preterm delivery occurs and a preterm baby is born, which will have to be kept in neonatal ICU. So this is the common complications of yeast infection in a pregnant woman. Now we have discussed the signs, symptoms and how to diagnose yeast infection in pregnancy. Let us come to the treatment. In a normal woman, we give oral antifungal as well as topical. But in a pregnant woman, we cannot give oral antifungal because of the associated risk of birth defects. So we can only give topical treatment. Topical means local therapy. But mostly women come to us with relapse and recurrences because they have not taken the treatment for the amount of time we have told them to and for the dosage. So I would recommend all patients to take treatment for the time duration we tell them and for the required dose. This will really help in treatment of the yeast infection in pregnancy. What if there are repeated yeast infections in pregnancy? One, as I have already elaborated, is that the patient has not taken the correct dose and the correct time. Second most important factor is gestational diabetes or diabetes in pregnancy, which is increasingly becoming more and more common. So if there is recurrent infection, we get a GTT or blood sugar test done. However, even if there is recurrent infection, we still cannot give oral antifungal. We have to wait till after delivery to give the oral antifungal treatment, and we still have to continue with topical antifungal treatment. So how can we prevent yeast infection in pregnancy? We should keep the area dry, wear cotton underwear. Our environment and our climate in India is such that area is prone to get yeast infection because of moist environment. We should avoid bubble baths, we should avoid feminine douches and sprays. These are very conducive to patient developing yeast infection. Also, we should get our blood sugars checked, and because gestational diabetes is increasingly becoming common in our country, and if it is high, we should control it. If you get gestational diabetes, you are very prone to get yeast infections in pregnancy. So today we discussed about yeast infection in pregnancy. It is a very common problem. We diagnose it by the history, which is a vaginal discharge, itching and erythema of the private parts. It is diagnosed by the doctor who will examine you locally and take necessary investigations if required. The treatment is local antifungal treatment, and most important is the prevention is keep the area dry and wear cotton underwear, and of course avoid the douches and bubble baths, etc. And we also, if you have blood sugar, it should be treated. If you have a yeast infection, it should not be ignored. You must meet your doctor and get it treated as soon as possible. Thank you.